MDMA is classified as a club drug. Club drugs are psychoactive drugs that tend to be abused by teens and adults at clubs, concerts, and parties. MDMA affects the brain with dopamine, norepinephrine, and serotonin. Dopamine causes a surge in euphoria, which increases energy and activity in the brain. Norepinephrine increases heart rate and blood pressure, and serotonin also affects mood, appetite, sleep, and other bodily functions. When large amounts of serotonin are released, it will likely cause the emotional closeness, elevated mood, and empathy felt by those who use MDMA. These chemicals make MDMA very addictive. People take MDMA because it induces a sense of well-being. They also do it for the high. But it is very hard to stop taking MDMA because it is both physically and psychologically addicting. 43% of users become dependent.
What are the effects of MDMA? MDMA can cause nausea, muscle cramps, blurred vision, chills, sweating, irritability, impulsiveness and aggression, and memory and attention problems. Prolonged use of MDMA can result in depression, anxiety, insomnia, kidney failure, memory loss, hemorrhaging, or even death.
MDMA comes in pill, tablet, capsule, crystal, and powdered forms. Ecstasy is a pill form of MDMA and usually is laced with other ingredients like caffeine or meth. MDMA is usually ingested, typically in pill form. It can also be snorted.
Now onto some street names. MDMA is referred to as Scooby Snacks, Dancing Shoes, E-Bombs, Ecstasy, Skittles, Disco Biscuits, Molly, and Beans.
Club drugs can be used medically. MDMA has been tested as a treatment for PTSD. Rohypnol or flunitrazepam is another club drug. However, it is illegal in the US, but it is not illegal in Europe. In Europe, it is widely prescribed as a sedative or a hypnotic. Rohypnol induces mild euphoria and sedation. Ketamine is mainly a dissociative anesthetic primarily used in veterinary medicine, and GHB used to be available as a dietary supplement in the US, but it was taken off the market in 1990. There's also LSD, which has been researched as a possible medication for reducing anxiety in patients with life-threatening diseases.
Next are some statistics. 6.8% of people 12 or older have had MDMA, and 1% in the past year. 0.2% in the past month, and 0.1% of people ages 12 to 17 have done MDMA. I interviewed Detective Gerald Jones, member of the West Central Drug Task Force. He talked to me about 6 drug cases that he has worked on. The first case was in 2013. 4 people were arrested in McDonough County. The suspects had no ties to the area. The suspects were arrested for the possession of 70 pills, narcotics, and other paraphernalia.
The second case was in 2015. A non-resident was arrested for possession of 40 pills and intent to sell, which is a Class X felony. The third case involved 2 non-residents. They were arrested for possession of 50 pills, a Class X felony. In the fourth case, a WIU resident was arrested for burglary. Pills were found during a search of the suspect. Detectives found more pills, and the suspect was charged with possession, intent to sell, and manufacture of drugs. The fifth case, an out-of-state resident was arrested in McDonough County. The suspect used the postal system to sell and deliver pills which were in powdered form.
The last case was in 2015. A WIU student was arrested on the WIU campus for possession, manufacturing, and delivery of the crystalline form of the drug. Now onto some fun facts. Did you know that celebrities like Eminem, Britney Spears, Quentin Tarantino, Miley Cyrus, Angelina Jolie, and Jack Black have all been reported to have taken MDMA? Did you know that MDMA was invented in 1912 by the Merck Pharmaceutical Laboratories as an appetite suppressant? And lastly, did you know that MDMA or ecstasy runs fourth after alcohol, cannabis, and amphetamines as the most widely used drug? Though MDMA is classified as a club drug, it is definitely not a drug anyone should try at a party or when they are alone. It is physically and psychologically addictive, and you can be arrested for the possession of the drug. And here are the sources.